Everybody, it's Facial Plastics Friday. Dr. Brace here, and I'm here with my good pal and colleague, Dr. Ben Taylor from Nova Scotia, and we just finished a cadaver course today, leading dissections of the face, the facial arteries, facial nerves, all the important structures for safe injectable practice. And I just wanted to bring Ben on here today, and I wanted to ask you, Ben, it was a great day. It was fun working with you. I was Ben's chief resident in residency, so I'm the old man. Ben's the young one. It was just fun to be together again. But I wanted to ask you, in your practice in the Valley in Nova Scotia, what's the most popular thing right now, and what do you foresee becoming more popular, being kind of the hot thing this year?
Yeah, I think it's variable. Certainly in my surgical practice, the most popular requests that are sought after procedure would be an upper lid blepharoplasty or eyelid surgery. Lots of variations on that, of course, depending on the needs of the patient, but that would be the most popular thing in my practice currently, and has been for the last few years. In the future, a couple of years ago, I found I had a lot of conversations. We did a lot of upper lip lift surgeries, and it seemed to have kind of fallen off over the last year or two, and starting to see an uptick in that. So I do think that a nice minor procedure surgery that can be done outpatient, wide awake, 30 minutes to an hour. So it's a nice little procedure. I think that we're going to see more and more of that over the next year or two anyway.
Yeah, I agree. I think that filler definitely has its place in our practices, in our aesthetic practices, but there's something about a lip lift where if you can really shorten the philtrum and get some unfurling of the vermilion, filler has that much more oomph and bang if you do that afterwards. So I agree. I think in my practice, it's going to be fat grafting, doing a lot more fat grafting. I think nanofat is really going to take off for skin thickness, skin texture, skin pigmentation. I think we'll be seeing a lot more nanofat. I think nanofat is going to permeate into, kind of like PRP, permeate into a lot of things. I think nanofat is going to be part of microneedling, part of laser resurfacing, part of a facelift, and I'm excited to see where that goes because there's lots of regenerative medicine properties in that, so it'll be fun to see how that technology evolves.
Yeah, I agree. I love it.
Awesome. Thanks, Ben.
Cool.
Everybody have a great weekend. We're going to be here tomorrow giving lectures, and be back in Guelph for Facial Plastics Friday next week, although it will be from New Orleans, not from Guelph. And so stay tuned, and everyone have a great weekend.
Bye.